Okay, let's dive right into this. Welcome to The Explainer. Today, we're tackling a mystery that honestly torments so many people every single day: chronic, unexplained jaw pain. We're going to demystify exactly why this happens, why it's so incredibly difficult to diagnose using traditional methods, and how an amazing piece of technology known as T-scan bite analysis is completely changing the game for patients. So let's get started.
Why won't your jaw pain go away? It's an exhausting cycle, isn't it? Waking up day after day with recurring headaches or having that deep, dull, aching feeling right near your ear and cheek. You've probably tried everything. You've taken the over-the-counter painkillers, maybe you've tried hot compresses or a bunch of home remedies, and yet the very next morning, that same stubborn ache is right back where it started. Well, it is incredibly validating to know that if those standard remedies aren't working, no, it is not in your head. You're just treating the symptom, not the source.
To understand what's happening, we need to define exactly what we're dealing with here: chronic orofacial pain. Now, this isn't just a brief toothache that vanishes after a couple of days. This is persistent, lingering discomfort in your face, your jaw, your mouth, or those surrounding muscles, and it can literally last for weeks, months, or tragically, even years. This kind of pain is unbelievably frustrating, primarily because it gets misdiagnosed so often. Why? Because when a dentist looks inside your mouth, there isn't an obvious, traditional cause staring right back at them.
And that leads us directly into these puzzling symptoms. Let's walk through them, because a lot of people don't realize they're actually all connected. You might have dull or sharp pain right around your ear or jaw joint. You might suffer from frequent headaches, especially those tight bands around your temples. Maybe your jaw clicks, pops, or even locks up when you open it. Or perhaps you're experiencing unexplained stiffness traveling right down into your neck and shoulders, or severe morning soreness. These mystery symptoms are frequently linked to muscle overuse, or what's known as temporomandibular joint disorder, or TMD. But the real question is, what's triggering that overuse in the first place? Section 1, the hidden culprit revealed.
So, the crucial point is that for a massive share of these mystery facial pain cases, the root cause actually traces back to something surprisingly simple, yet completely invisible to the naked eye: an uneven bite. And this brilliantly illustrates the concept. Think of your jaw just like a car's wheel alignment. If even one single tire on your car is slightly off balance, what happens? The entire vehicle starts pulling to one side. The engine has to work significantly harder, and the mechanical parts wear out way faster than they were designed to. Well, your jaw functions exactly the same way. If things aren't perfectly aligned, the whole system just suffers.
Let's look at the actual chain reaction of what happens when your upper and lower teeth don't meet evenly. It forces just a few of your teeth to absorb a massive amount of chewing force, way more than they're built to handle. Over time, this overloads specific jaw muscles, leading to chronic, exhausting tightness. It heavily strains your temporomandibular joint, which is what causes that terrifying clicking or popping sound. It sends referred pain shooting right up into your temples or down your neck. It literally wears away your tooth enamel unevenly and keeps your facial muscles in a constant, low-grade state of guarding, which just entirely depletes your body's energy.
Moving on to Section 2, meet the high-tech detective, the T-scan.
The tricky part about all this is that humans simply cannot feel these tiny, microscopic bite imbalances on our own. It takes highly specialized equipment to actually see what's happening. For decades, the standard method was using a little piece of colored articulating paper. You bite down, and it leaves an ink mark, kind of like a dental Rorschach test. But it's totally subjective. It only shows where the teeth touch and leaves massive room for estimation. On the flip side, T-scan digital analysis provides objective, repeatable, numeric data. It completely removes the guesswork from the equation, taking us from a rough estimate to an exact science.
So what is this tech actually doing? When you sit in the chair, you bite down naturally on an ultra-thin sensor strip, and instantly, the T-scan records not just where your teeth make contact, but exactly how much force each individual tooth is applying. It records the precise sequence in which your teeth touches your mouth closes and the exact duration of each of those contacts. All of this incredible data is instantly converted into a clear digital graph and a really detailed color-coded map right on a computer screen for the dentist to evaluate.
Milliseconds. The T-scan sensor measures the timing of your bite down to the millisecond. This is absolutely crucial to understand, because while you, as a human being, cannot feel an imbalance that is a fraction of a second off, your jaw muscles for sure feel it. Over thousands of bites a day, a millisecond imbalance is more than enough to cause severe, chronic, debilitating pain.
Section 3, solving the case with data.
Now, what's really interesting about this slide is how that precise millisecond-level data translates into lasting relief for you. Once we have the data, the mystery is officially over. First, it pinpoints the exact source of the imbalance. No more guessing. Second, by showing real-time force distribution, it perfectly explains why you might have pain completely isolated to just the left or right side of your face. It then allows the specialist to design a highly targeted treatment. Maybe that's a custom night guard or just a microscopic adjustment to your enamel. Plus, it tracks your progress objectively, heavily reduces those frustrating trial and error visits, and critically, it protects any expensive dental work you might already have, like crowns or bridges, from being quietly destroyed by a bad bite.
Section 4. The Patient Experience at Apollo Dental Nallakunta.
So what does it actually look like to step into a clinic and experience this high-tech analysis yourself? Well, behind this technology is over 17 years of specialized clinical experience brought to the table by Dr. Ancy V. Ignatius. When you're dealing with chronic, complex pain, experience matters tremendously. The clinic also features a multidisciplinary team, which means you've got prosthodontists, orthodontists, and oral surgeons all working collaboratively under one roof to crack even the most complex oral facial pain cases.
Let's move to the next part and see how this builds. The actual consultation process is incredibly straightforward. It starts with a detailed history, followed by a clinical exam. Then comes the magic, the quick T-scan recording. It is totally painless, entirely non-invasive, and there is absolutely zero drilling involved. After the quick scan, Dr. Ancy and the team sit down and do a plain language data review with you, actually showing you those color-coded maps on the screen. From there, they build a personalized treatment plan based on the data. And finally, a follow-up scan ensures your bite has properly stabilized.
This is the biggest takeaway from our explainer today. Stop masking the pain, find the root cause. Chronic oral facial pain almost never just improves on its own. Popping painkillers is nothing but a temporary band-aid, you know? It just provides fleeting relief while the underlying bite issue quietly continues to wreak havoc on your jaw, your muscles, and honestly, your daily life.
So, are you ready to stop guessing and start treating? If you've been living with a jaw that clicks, a head that constantly aches, or a face that just constantly feels exhausted, you do not have to just live with it. For residents in and around Hyderabad, booking a consultation at Apollo Dental Nallakunta is your first step to leaving the guesswork behind. Ask yourself, how much longer are you willing to let a fraction of a millisecond control your quality of life? It's time to get your life back.